Good morning, guys. Tony Maritato here, licensed physical therapist, and I want to talk to you about some positioning strategies to help improve your knee flexion, the bend of your knee, while you're resting and recovering at home. One of the main things that I typically recommend is we want the knee flexion to come comfortably. Yes, there's going to be times in therapy where we're going to push the range of motion and it's going to get a little uncomfortable. But there's a huge difference between discomfort and pain. Most of you can tolerate discomfort. Most of you understand the value of discomfort, but pain doesn't really gain much benefit for us. So let's talk about some positioning things that we can use. This is just a standard chair, 19 inches off the ground. I'm 5'7" to give you some perspective on height. But basically, if you're sitting in a chair, relax, maybe it's a kitchen chair. If the foot is resting on the ground, it's not necessarily getting the benefit of gravity to help improve the flexion. So if you're not at 90 degrees of flexion, which would be a right angle at the knee, a great simple strategy is to use a regular pillow. It could be a throw pillow. This is a pillow from a bed. I fold it over, and what I'm trying to do is bring it up underneath the thigh so that it flexes my hip, brings my knee above hip level, and allows gravity to work on bringing the foot down. The weight of the lower leg is doing the stretch work for me. And this is a comfortable position. It's a position I can sustain for 5 minutes, 10 minutes, depending on the intensity, depending on how tight the knee is. Now, most clients, when you first get into this position, there's going to be a natural tendency to tighten the quadricep muscle, which is going to kind of keep the foot elevated. You'll feel the sensation, you'll feel the muscle, it'll be a little sore, fatigued, burning a little bit. But what you want to try to do is get the mind to relax. Maybe you do a little meditation, maybe you do some deep breathing. And so as time goes, as I get this muscle to soften, the foot will drop lower. If you want, you guys know I'm a huge fan of the rolling pin massage. What you can do in this position is apply the rolling pin massage to the upper thigh. Now I try to focus the pressure toward the heart, back toward the hip, so that if I do have some excessive fluid, some swelling, some edema in there, I'm kind of creating a little bit of a vacuum effect, bringing the lymphatic drainage back into the system to allow the kidneys to process it. I spend a couple swipes on the outer thigh, the top of the thigh, the inner thigh. There's still a lot of procedures being done in which they're using a tourniquet to restrict blood flow. That tourniquet will cause thigh soreness, thigh pain. Probably the second most common complaint I see in the clinic is thigh pain. Calf pain, number one, thigh pain, number two. The pain from the knee incision, that's the lowest on the priority list in the first couple weeks. So anyway, I'll spend maybe 2 to 3 minutes, watch a clock, working the massage so that I can move the fluid out of the area, facilitate fluid exchange, and just try to get to the point where the foot and ankle is just hanging. It's suspended. It's completely relaxed to the best of your ability. Once I've done that, I'll remove the cushion. And one of the ones that I like to do is I also like to massage the calf muscle. I've already created a vacuum effect above the thigh. So then what I'll do is I'll use a palm up grip and I'll just allow the weight of my leg to work through massaging the muscle of the calf. I'll do about 1 to 2 minutes of swiping the back of the calf muscle. And then I might do another 30 seconds to a minute working the peroneals, the muscles that run along the outside of the shin bone. I'm not applying any pressure to the shin bone. I'm not applying any pressure to the kneecap or where the incision is. All of this is done on the soft tissue, the muscle, tendon, ligament that surrounds the area, but not necessarily over the incision. So guys, this could be done starting 1 day post-op. This could be done for a year post-op. There's never a bad time unless you have been told that you have blood clots or unless you have been told that there's a reason that you don't want to apply pressure to soft tissue, blood clots being the primary reason. But absolutely talk to your surgical team, talk to your therapist, see if a rolling pin massage and some long duration, low intensity knee flexion might help you gain the range that you're just not getting with all the other stuff. Guys, thank you so much for watching, and I'll catch you on the next video.